Welcome everybody to our DST app webinar. I'm very excited to talk about injectable composite veneers using a 3D design tool, which is the amazing Digital Smile Design app. For those who are here on Zoom, we have a chat on the right corner where you can just chat with us, tell us where you're from, your specialties, how long have been working with digital technologies or not. If you have just started your workflow with it, or if you want to learn more about it. We want to know your specialties. We want to know everything about you. We have doctors from all over the world as usual, and we are very happy to know that we are changing the way dentists see dentistry and the way that patients see dentistry as well. If you are on our Facebook Live, there is a chat box, and we have Mark Anthony, which is our integration consultant. He is with you on the chat on Zoom and on Facebook. Hey Mark, how are you doing? You're on mute.
How you doing, Dr. Diogo?
I'm doing great. Thank you. So Mark, as I was telling them, it's been such a bless to be part of this digital movement, because we have been sharing so much content, so much information, and it's all for the best of the doctor. It's all for the best of the final consumer, which is the patient.
It's
so,
been
and I was
fun.
What?
Dr. Diogo, yeah, it's been really fun, and I know you and your team have been really working hard because, we have been bringing new content, new topics every week. And so we have, every Wednesday we have our live demos, right?
Yes.
Thursdays is what do you do on Thursdays? The study clubs, I believe, right?
Correct. We have study clubs for our gold members. And then like once in a while, like every 2-3 weeks, we have our webinar where we discuss the power of 3D design, the power of patient communication, and all other like amazing topics using this digital technology.
Our dentists have been really, my hat goes off to you, because yeah, the feedback we've been getting is that you've been doing a fantastic job with the content and bringing some really great topics to the forefront using the DSD app. So my hat goes off to you, my friend.
Well, thank you. Thank you. And to Ralph as well, Ralph George, which is the CEO of the DST app. He is the master of technology. He was the one who brought, these concepts into a reality. So hands off to him as well.
Oh, Ralph's the wizard. Yeah, Ralph's our wizard, man. He's in another level. Absolutely.
Awesome. Amazing. Yeah. And, we are a global company. We have 37,000 doctors who are using the app at this moment and changing lives all over the world. But today I want to be very specific on one topic. And we have here Dr. Sussman. He's like, wow, I can't wait to see this one. I can't wait to hear more about the injectable composite veneers.
Oh, hey, Dr. Sussman. Yeah, great friend of ours. Welcome.
Okay, perfect. Let's go and my computer's on fire. Perfect. There you go. Earlier today, in our gold members meetup, we had this discussion about the new normal. So before I jump into the injectable composite veneers, I want to kind of like go back a little bit. Let's go back to February 2020. How was your workflow? How was your professional workflow up to then? I mean, our was, going to the office, focused on seeing our patients, focused on, doing the best that we can to provide the best care the best care for our patients. But then COVID-19 arrived, and then it changed everything. A lot of offices had to close their offices all over the world. So my friend, you're not alone on that. A lot of offices lost a lot of revenues, a lot of offices lost a lot of patients.
Right.
And what happened there? During this pandemic, all of us became so well educated in so many platforms. Now everybody's so connected to everything that since a few months ago to now, people are becoming so knowledgeable with so many like specific topics that it's our job to reshape the way that we present our cases to our patients and reshape the way that we present treatment plans to our patients as well. In this new normal situation that we live right now, our patients, they are looking for transparency. They are looking for new technology. They are looking for new ways of engagement. They are looking for convenience. They are looking for a way where a treatment plan can fit in their financial means. They're looking for viable options. And what is your goal? Your goal is to learn how you can maintain that patient in your practice and make that patient love you, make that patient thank you for giving them an option that is still aesthetic, is still functional, but it's also available to their financial means. So that's extremely important, and that's what we're gonna go for today with this webinar. So I really want you to listen, talk to me, talk to Mark. You wanna make this a conversation, very conversational, because it is really important for you to open up your knowledge and your approach when it comes to maintaining your patient, when it comes to having new patients to your practice. And there is a quote that I like to say that you win when you provide your patients treatment options that can give them a better lifestyle. Think about that. We have many options, right? We can provide the world to our patients. But even if we approach with all the care that we have, can they always afford to have the treatment plan that we are giving to them? Especially now where millions of people have lost their jobs, or millions of people are laid off, millions of people have experienced a reduction on their salaries. Yeah. A lot of people, they are still willing to purchase. They are still willing to get something for themselves. But is it the right moment for them to purchase? Of course, our goal here is to always sell the full mouth restoration, porcelain veneers. But then, can they afford that at this moment? So what I want to teach you today is how you can implement the injectable composite veneers technique in your practice with using low cost for you and for a patient, and use it as a transitional procedure so they can decide to have the porcelains in the future. As we know, when it comes to resistance, ceramics has a extremely higher resistance compared to composites. However, you can still give your patient something that they want and make them participate in the process and make them wanting to go for porcelains in the future, because they will know that it's transitional for a couple of months, for a couple of years, but they will have that moment, this period, they will have a harmonic smile. They will have something that they can be proud of. And they will be wearing your work, let's say like that, in their mouth throughout this period. And you will win this person. So that's the mentality that I want you guys to to stay with me, to focus with me today. Then, of course, you can come and say, well, perfect. Then let me go ahead and do my traditional composite veneers. I can just get my patient, I can get my composite, and I can start doing all of my veneers on top of the teeth, do the minor prep and this and that. Yes, of course you can. However, I want to give you a new approach, which involves the patient experience, which involves digital workflow, which involves natural texture using the 3D, facial integration, and patient collaboration. So here on your screen, you'll see on the left side, we have the traditional composite veneers. It is the most common technique. We all know how to do it. However, it is time consuming, especially when you're doing 6 composite, for example, 8 composite, 10 composites. It is very operator dependent. So it depends on the skills of the patient, of the doctor. It could become a little difficult to replicate every single unit, but it is an affordable option for the patient. Go ahead.
Can I ask you a quick question? So Dr. Thomas chimed in and she said, so in the 2 stents given for the injectable composites, how do we do it? So what are those steps? When I tried the last time, the second stent was hard to fit and ended up losing the contact points.
I will show you. We have some examples here. All right. Okay. I have one patient. The first photo that you saw on this webinar, it's my patient. This lady is also my patient. I have some footage where I can show you exactly how you can create a contact points using the GST app in this webinar. Okay.
Right.
Right. So let's go to the digital composite veneers. In the digital composite veneers, what happens is that you have the natural texture from the 3D design, which means that that buccal surface, which is the hardest part when you are creating the composite veneers on the patient's mouth, it becomes like the hardest part of it. So we have the natural textures, we have the facial integration. So you're not just designing teeth on a model, you're designing it and creating that smile design based on the patient's facial structure. Of course, it requires a digital training. That's why we have courses where you can learn on how to do it on your own. And that's like one of the questions that Dr. Thomas is asking here, and I'll give you the answer pretty soon. You get the possibility to replicate multiple units at the same time. So it shrinks the time, and that's something also that your patient is looking for. Especially during this pandemic, they just want to come in, do the treatment and get out. You will be then increasing your productivity because you will be doing a faster procedure. And then of course, it is an affordable option for a patient, an affordable option for you as well as a clinician, as a business owner. But for us to give this option to the patient, we have to consider who is our patient and how do we understand that step? How do we make our patients capable? I mean, a great candidate. I'm sorry for the injectable composite veneers. The first thing they have to do is to create a patient interaction. So by doing a patient interaction, I mean that you should do a DST app motivational smile simulation. That is something that you can do with your iPhone. I will show you here how you can do it. You will, as you're talking to your patient, you can understand what your patient is looking for, or you can create something that your patient wasn't even expecting by designing a smile over the patient's photo within a minute. That's the first step for you to understand what your patient wants. And then you do the clinical exam to analyze that patient's clinical conditions and do the complementary exams to do the same thing. So once you digitalize your patient, you get a full understanding of your treatment plan. And that's what we call the backward treatment plan. You envision what the patient wants, then you collect the technical informations to then apply into your treatment plan, and then you go from there in order to get the final result based on what the patient needed and patient wants it. And then of course you start your 3D composite veneers guide. Cool. Let's go ahead and I'm gonna show you here the motivational smile simulation, so you guys have a better understanding on what I'm saying here if you are not a DST app Gold member yet. There we go. So on your iPhone, as you're talking to your patient, as you're giving information, you're receiving this information from your patient, you take a frontal facial picture of them, and the artificial intelligence of the DST app will automatically help you on the design process. All that you have to do is to set some parameters based on the principles of smile design and based on your clinical experience and expertise. So as you can see there, we are shaping now the smile curve of the patient, and then the app will give you a suggestive smile based on the patient's age and based on the patient's facial structure. And you are done. You open up that conversation and you can have that smile simulation where you understand what the patient wants. That's the first step, the kickoff meeting, let's say like that. Then of course, once you're doing your clinical exam, let's go. Once you're doing your clinical exam, I want you guys to see it. Great. You have to pay attention to some structures on the patient's face and teeth. For example, the patient's facial structures such as if there are such muscle changes and irregular jaw movements, so then you would have to treat that first. You would have to analyze where the position of the lips are when the patient is in a rested position or smiling. Check the occlusion of the patient, check the overjet, the overbite, the protrusion guides, the existing protrusion guides and lateral guides. Analyze the buccal corridor of that patient, the position of the current dental midline and teeth in arch, the quality of the gingival health, and any other notes that you find important in order to give the patient that technique. Of course, we have the indications for the injectable composite veneers, and we have the contraindications for injectable composite veneers. And I want to show you, I want you to think with me, on that, so you can give the patient something that will last for months or years until they decide to go for the next step, which is the porcelain material. Indications, of course, diastemas, peg laterals, patients who has a class 4, who needs a class 4 restoration, slightly malpositioned teeth, patient who needs a minimally invasive prep or tooth reshape and contouring, and also patients who are looking for an affordable option. And then we have the contraindications. In the contraindications, some of them are reversible, meaning in your treatment plan, you can reverse that and make the patient able to do the composite, such as people who do clenching. You can treat the muscles of the TMJ first. You can do some night guard first. You can, if they have like worn out teeth, you can open up the bite, the vertical bite on the posterior first, to then make them a great candidate for these composite. But people with class 3 of angle, they are contraindicated. People with extremely dark discoloration that even after you do the internal bleaching, it still doesn't work. So it wouldn't be an indication because the composite veneer is extremely thin. Patient with moderate to severe malpositioning, position or crowding teeth also, they need to do ortho first, and then you can go for the composite veneers. And patients with flared teeth, same situation, do the ortho first, and then go ahead and do the composite veneers. So here it says contraindication, but it's, some of them are transitional to indicate it. You have to train yourself into the treatment planning and explain the patient on how you go with the procedures to get into that final result. Am I going too fast here, Mark?
I think you're at a good speed right now.
Perfect.
Let us know in the chat if everybody has an issue, but I think you're doing a great job.
Great. So once you get your ideal patient, once you have that patient that needs some contouring, that needs some closed diastemas, and they're ready to jump into this clinical option, you then go ahead and do the designs using the GST app. The GST app will not do the work for you. It will do the work with you. This is why you have to have the knowledge on how you're going to be creating this treatment plan for the patient. And you will see that, as we said, it does require some sort of training. And that's why Mark is here to explain you how you can do that. But once you understand it, my friend, I can tell you, it becomes an amazing tool because you reduce these visits, with the patient. Let's say while the patient goes ahead and come in to the scanning, then we send it to the lab go ahead, send this whole material back like 2 weeks after the patient comes in, and then you have to try it out in the patient's mouth. Maybe it doesn't work. So you have to send it back to the lab, wait another 2 weeks, and then you ended up losing the patient because they lost their moment. When you are able to do it in the app, you are the owner of the project. So if you're the owner of the project, it means that you can make any modifications before you send it to print or after you print. You can do a virtual consultation with your patient and say, this is how your design will look like. What do you think? Do you like it? Do you love it? Great. Next time you come here, I'll have everything ready for you. Let's start our clinical procedure and let's have it all done in one consultation. Beautiful. This is what the GST app can do for you. We can do prep guides when it comes to minimal preparations, minimally invasive preparations. We can use it, the composite guides, when we are using for an additive restoration. If the patient needs to try it out first, we have what we call the GST app shells, or the traditional mock-ups where you can print, use the bisacryl, place on the patient's mouth, or print that little shell thing that you see in the middle there, and then place on the patient's mouth so they can try it out first. So there are many options that you can do it. And then, of course, we have the injectable composite veneers technique. That's how I like to say it, right? The injectable composite veneers technique, it gives the patient that opportunity to go through a transitional period where they get to test drive their smile for months, and in certain cases, years, until they decide to invest their money into a permanent alternative like the porcelain veneers. I want to give you here an example. So this patient, that was in December 29th. Yeah, December 29th. I was in Brazil, I was working, and we got this patient, and he's a young patient, and he needed something that was like quick, fast, but also something that was affordable. I could not offer him the porcelain veneers to be done, for his New Year's event, as he had to work. So what was the affordable, quick option that I could provide to this patient? The injectable composite veneers using the digital technology. Everything was done in-house, all the design, the 3D design. Then we just sent it to print, created the indexes, and then we had the patient right on the next day, and we could close the deal. So I will show you how the procedure itself worked. We did the 2D smile simulation, as you guys saw it there, right? And that was something that we did with the help of the GST app. And then after the patient approved, we started our 3D design. So as you can see there, on your iPad, what you can do with the app, you will be calibrating an STL over the patient's picture in order to design a smile that is facially driven and that will give you the right shape and design for your technique. You calibrate the STL in different positions, so then you know the limits of how much you're going to be prepping after you do the clinical exams and the complementary exams. You then select the smile design. You place the 3D teeth over that design that you created in 2D, as you can see over there. I'm now reshaping those 3D teeth and positioning them within the smile frame that I designed in 2D. Now, right there, for example, we have the canine. We are placing it exactly at the same frame. So it continues with that facially driven design, the facially driven approach. Everything done with the GST app in the office. And then, oh, there we go. So that's the answer for you, Dr.
Thomas, is it?
Dr. Sussman. Right there, when you go to the, there's like 4 views. You go to the one on the bottom right corner. There, you can change the opacity of the existing model, and you can adjust the contact points right there, because now you see only the new design. So when I was doing that, I was recalibrating those 3D teeth just so the contact points could touch each other properly. So when I did my design, my technique, it would just fit in the mouth correctly. To make sure that you have the design the way that you want, you have there a kind of like a proof of the 2D design and then the 3D design to make sure that they all look the same. And then we have this is like my favorite part. It's like teeth mounting, it's like you're waxing the tooth digitally. And there you could do like any final adjustments on your design, such as, like better the contouring on the gingival margins, or, you can just like make the tooth a little bit more buccal or less buccal, just like change a little bit the cusp on a premolar, for example, or recontouring the shape of the canine just a little bit. And after you go from that step, what do? You send it to print. Or you can send it to a CAD software in your lab, and they can do any adjustments that if they like. So I'm doing just some final adjustments. There we go. You tap that export STL. You send it to the email. It could be your own email. It could be to the email of the lab who is going to print if you don't have a printer. And once you print, you will then create your indexes, which is something that we also teach in our course on how you can create the indexes for the technique and the technique itself. In this case, you guys can see that there are some teeth that are overhanging the 3D design. When I changed the opacity of my model, I could see that that was like a 0.2 millimeter teeth that were overhanging. So very minimally, very extremely minimally invasive. Just in the enamel, in this case, I did not do any anesthesia on this patient, as everything was super gingival, as I wanted to preserve as much enamel as possible for the porcelain veneers that he is going to do in the future whenever he is ready for it and financially ready for it. And then that is the final result the day after. Very simple, and you guys can see on the video on the right side that I did not touch the buccal surface. I just did polishing and finishing, and the natural morphology was there, and that was something that I did not touch on. Of course, some adjustments in the buccal, in the incisal edges here and there, that is totally normal, but the major work was done with my designing on 3D and with the technique itself. Here I have another patient, which is that's recent, and same thing. She was not ready to invest her money onto expensive services that we could provide. However, we could give her implants. We could give her close all the spaces in the back, and then give her the composite veneers on the anterior teeth. She's aware that she needs to go through ortho. She's aware that this technique is reversible, and it's just so she can live her life happily right now, as she was also in a very she was in a stage where she was like sad with herself, and she was very concerned about her own smile. So by giving her something that is affordable to her, but also to give her something that will make her happy, is priceless. This is our job as dentists. This is what we have to do. We have to provide services for all. We have to bring this energy to our patients, make them fall in love with our services. The more we do that, the more patients, the more retention you get with your patients, the more referrals you will get. Because now, look, this patient is walking around with my work on their mouth, and she didn't only create, had some composite on her teeth. She also got an experience because she also participated on this procedure.
Yeah, that came out really, really beautiful work right there. And it's like you mentioned, there's that part about the oral health, but really you just touched on it. She was in a depressed state. You went, you helped her out. I mean, you changed the quality of her life. And it's like you said, that's really priceless. So very
exactly.
Cool.
And Mark, right now, honestly, I would say 95% of the population, they need some special care at this moment.
That's a fact.
We are all affected by the isolation, by our own thoughts, and a lot of people are now looking for something that will bring their confidence back. They're looking for something that can revive their spirit. Absolutely. And there is nothing better than reviving their spirit by giving this patient an affordable option. And once this patient is ready, you can bet whatever you want. This patient will go back to you. Of course, it's a composite. So this patient will need some maintenance every 6 months. But hey, every patient needs maintenance in their gum levels to do the cleanings and all that anyway. So it doesn't hurt, and you also create that relationship with your client. Here, I want to show you that we have not just my case, but we have like other cases from doctors from all over the world using the DST app for other treatment plans as well. And you can find that on our website under resources, or if you go on our DST app, when you tap on the menu, that is one tab that says DST app news. Go on your iPhone and you will find the case reports there. We want you to understand it. We want you to learn. We want you to reshape your workflow. We want you to get that excitement on your patients from day one and make them feel amazed by the work, the hard work and beautiful work that you do. And for those who are not members yet or wanting to get started,
Sure.
Mark, can you guide us on how they can educate themselves on getting to this path along with our 37,000 doctors?
So great, Dr. Diogo. So the easiest and most common way for our participants and for our doctors out there that are watching this is to become a gold member. And so becoming a gold member, you will receive the app, right? So you download the app on your iPad and on your iPhone. And so on your one account, you can have up to 5 iPhones and 1 iPad. And with these membership benefits included, unlimited smile designs on your iPhone and iPad, you get unlimited 3D design projects, you get access to our content, including virtual study clubs. We have our learning meetups. We offer our support. So again, our dentists are there for you. If you have a case you want to work on, we can help work on it with you. So you really get premium support from our dental professionals, which is really, really a great value. And so that would be step one. So a lot of our members get signed up and they start with the gold plan. But what I am most proud of is due to the COVID, what we've spoken on, our team has really come to the forefront and really brought online education and made it interactive and made it educational and fun. And so for those of you that are interested in this injectable composite veneer course, what we can do is we have a bundle offer. And so with this bundle offer, you would get the app, the gold plan, and you would get our 6-week injectable composite veneer course. And so what the injectable composite veneer course touches on is everything that Dr. Diogo spoke about. And, you know, it's that smile design to 3D design, and involving the composite techniques. We have weekly roundtable Q&As where our participants are able to chat with our instructors and go over best practices. And so the feedback we've been getting from these roundtable Q&As has been fantastic, and it's really enjoyable to see. So that is one way. And then we have another bundle, which is the Smile Designer course. And on that is just your basic fundamentals on how to use the app and going through those different avenues. On this online composite veneer course, what we'll do is we'll cover the principles of smile design, 3D guides using DST app, how to digitalize your patient. So you include your DST, you include your digital x-rays, how to include, you know, your STLs, the flowable composite technique theory, we go in depth into that, how to actually export your CAD/CAM software so that it's able to print. The guide index is included. So all of these benefits from the online composite veneer course. And again, you get the access to the app, you get the on the iPad and the iPhone. You get our app portal with all our content, our premium support, and also with this online course, as interactive as it is, we are going to give you homework assignments. So we're going to make you work. We're going to make you think. Our instructors give you feedback on your weekly homework assignments. We go through questions and answers. And it's a 6-module course, 6-week course. And I believe our next one begins on September the 14th, if I'm not mistaken. And so for those of you participants that are interested in joining, it would start on September the 14th. We do have limited tickets available. So if this is something that you guys want to get involved in, please send me an email. You can reach me directly via WhatsApp on the 302-898-7816. I do want to offer our participants who are watching a special discount code. So if you can email me, if you can email me and tell me you're interested, I will share with you that code so that you can see the discount savings on joining us for this online composite veneer course. Okay.
Wow, that's
It'll be
something.
good.
Yeah, I didn't know that, but that's amazing.
Yep.
Yeah. Right now, guys, it's your chance to become a digital smile designer, to learn more about new techniques to provide your patient the best experience that they can afford and the best experience that they can have in the future based on what you're designing right now. Mark is the interracial consultant at DSG App. He's an expert. He knows exactly the needs of your practice. As you guys talk to him, he'll be like setting up a meeting with you to discuss the best options for you. Absolutely. So thank you, Mark, so much. I want to thank everybody who stayed here with us. We have doctors from all over the world. We have like hundreds of doctors. Thank you so much. For you who is watching us on Facebook Live, I want to thank you as well. And let's change lives together. Let's be the best that we can for our patients. So I want to exit here. Mark will be here for a few more minutes. Thank you guys so much. And I will see you next week, anytime soon.
Thanks, Doc. So I will hang out here. If there's anybody that has any questions, wants to connect on anything, I'm probably going to hang out for another 60 to 90 seconds. Okay. And see you guys next week.